I got diabetes for my 5th birthday, so that was the worst present ever. I live with my sister. And before that, I lived with my sister, my dad, and my mom. My mom passed away, my dad took off, and so it's just me and my sister now.
Kendra is in her mid-20s. She has major depression. She has type 1 diabetes, which she's had for most of her life, and has kind of gone through periods of up and down with her depression and her subsequently her diabetes control.
The whole time I had diabetes, I mean, which is my whole life, I think it's 21 years now. I just struggled with my weight, and when I was 12, I was in the ER like 11 times, and I weighed 48 pounds.
She was not showing up for clinical appointments, had a lot of family dynamics going on that complicated the situation. She did not have a lot of supports and very limited financial access.
Last summer, Melissa, our nurse case manager, approached me and going through our diabetic registry had realized, she hasn't been seen for a while. Melissa and I spent probably 5 to 10 minutes initially just kind of going through her case and discussing ideas back and forth of what we could do.
And then we formulated a plan of how to start approaching it.
When we had that initial visit, we had all 3 of us. So Melissa was there and Kendra and myself. There was a little resistance. She was, as I mentioned, she was very depressed, wasn't feeling well because her blood sugars were out of control.
I can remember that they said that they were going to help me with my diabetes and trying to manage it, and they were going to help me with try to sort out my problems. And when I came here, I felt like I had some actual support. Most of the time, I've been clueless as to what to do and need help, but I never really received it. But then when I came here, it's like the opposite. Dr. Jones has been the best doctor I've had for my diabetes since, well, ever. He's really nice and supportive, and because of that support, I feel like I'm capable more of taking care of myself.
You could tell she became more empowered to start managing things on her own. She started asking questions and seeking out information, getting more involved in her care. She became less isolated. She's more active physically. She reports having less pain and less symptoms. And she actually desires to do social activities and be out of the home. And before, she just did a lot of self-isolating.
Melissa, in my opinion, is like my mom away from home. So she's always helped me and been nice to me. She helped me get my ID. She helped me with food stamps. She helped me with my health card when my health insurance was dropped a couple times.
There's so much more than just the medical problems that are affecting her health.
So there was like the emotional side of it that we were not focusing on because we're focused more on the medical thing, and addressing and meeting those emotional needs made a huge change.
As a physician, there are many things that I want to be able to do for my patients that I can't, either because of time or resources or expertise. And so having other people involved and having everyone work together for the patient really makes it crucial to make sure the patient gets what they need.
The success of it is to communicate with each other on a continuous basis.
It brought more to the forefront, and it was something that we could work on together and say, okay, well, this is a need. What can we do for her? And so it was a work in progress. But as we worked together, we were able to get her the resources that she needed.
Generally, I'm doing better, and I eat actual food now too. So I'm not an out-of-control child anymore. I know how to, behave without, causing everybody to feel uncomfortable, or I'm not mean to everybody anymore. I just always kind of relied on this place since, they started helping me. Everybody's really nice. It's like, I can trust people here. I could have been a lot worse without them.
If we didn't have our diabetic registry and someone looking at it, she would have just completely fallen off our radar. She wouldn't have gotten any of this help without the team involved, without having a care manager that's helping with these resources and look at all of these, the registry of our patients and help us follow. So utilizing the team in order to care for our patients is essential to care for some of these patients like Kendra that need a lot of extra help.